the drugs acting on the skin and mucous membrane. So these podophyllin resins, they are especially effective against the warts, and the alcoholic extract of the rhizomes and roots of the Podophyllum species, it is obtained from the plant, and it exists as a pale yellow to yellowish brown powder or the masses, and podophyllin resin is a cytotoxic agent and is used for the destruction of the warts, a very good agent for the human warts is concerned. So as a caustic, it is used as 10 to 25% alcoholic solution and suspension in a areca soil or any other mineral soils. So the direct exposure of this drug to either or the eyes, etc., should be totally, it should be avoided. That's the podophyllum resin. It's combined with benzene, then alloys solution. So this is a podophyllatoxin, a highly toxic substance, of course, but it is used commonly for the treatment of the warts. And trichloroacetic acid or TCA, or it's an analog of the acetic acid in which the 3 hydrogen atoms of the methyl group have been replaced by the chlorine atoms. And TCA exists as the deliquescent and the colorless crystals with pungent odor, and it is less soluble in case of water and highly soluble in alcohol and also the ether. And trichloroacetic acid is widely used in biochemistry for varieties of the experiments are concerned. So the TCA, it's available as the crystals, and the dilute solution may be used for the applied of the ulcer and to clean, stimulate the growth of the tissues. And application of the caustics for disbudding or dehorning. So what are all the applications? So the caustic preparations, especially disbudding in cows, should be applied very carefully because the horn, what is growing bud, it is a delicate tissue. Before you are going to apply the caustic to the tissue is concerned, the horn bud area should be cleaned and defatted with the ether or chloroform. Then after the hair, especially the around the area should be cleaned and defatted. Later it should be removed and the protective ointment like zinc oxide ointment should be applied. Then the caustic agent is applied carefully by a short, stiff, blistered, small brush. Then for better results, debudding should be carried out within 48 hours of the birth. Please remember, the many farmers will ask the question, sir, how many days I can debud the animal? But within 15 days is always better, because once the keratinized tissue is formed, it is very difficult to debud it. Then hot iron rod is required. The keratolytics and keratoplastics are there, and these are the ones which soften and loosen the keratinized epithelium and facilitate its desquamation. So keratoplastics, on the other hand, attempt to normalize the keratinization by reducing the excessive scaling and the hypertrophy of the horny layer of skin and tend to prevent the formation of the more scales. So the primary mode of the action of the keratolytics is to stabilize, solubilize the intracellular cement of binds and scales together in the stratum corneum of the skin, and especially lot of debris are formed and the keratin tissue is formed, which always hinders the healing process, and hence they need to be removed properly. Then the keratolytics and keratoplastics help to remove the defective skin layers, and especially in case of psoriasis, then hyperkeratosis. Then the, of course, salicylicum or salicylic acid, then urea, then tretinoin, these are all the used. These stimulate new skin layers and production. So then all these are inhibit the stretch marks especially. Then keratoplastics act is primarily by slowing the basal cell proliferation to the DNA synthesis. So all these keratolytics and keratoplastics are used mainly on hyperkeratotic lesions, especially corns, warts, psoriasis, chronic dermatitis, etc. And many of the keratolytics available today are the keratoplastics, hence they are generally discussed or usually it is together. And hence the important agents to remember under the category of the keratolytic is the salicylic acid, the benzoic acid, and resorcinol. So 3 of these are important agents, and many times they are combined together. So the first agent here is the salicylic acid. it is a light, what you call as the feathery crystalline powder or colorless crystal, which is obtained by both natural and the synthetic sources. Whereas the natural sources are mainly oil of wintergreen and oil of the sweet birch. So the salicylic acid is less soluble in water and readily soluble in either ether and chloroform. So the salicylic acid is usually or topically applied as the keratolytic and also the keratinoplastic. And also some of the time it is anti-seborrheic in action. So it has both antiseptic and antifungal activities. So the keratolytic agents, desquamation of the tissues is caused by dissolving the intercellular cements and binds the scale in case of the stratum corneum. And usually it's one of the component in case of the Whitfield ointment. You might have heard, especially what is benzoic acid and salicylic acid ointment is called as the Whitfield ointment. So this Whitfield ointment is very commonly used in case of most of the time the fungal induced dermatitis. So it is salicylic acid is anti-pruritic in nature and also the anti-inflammatory. So if it is taken orally, then it is anti-inflammatory. Salicylic acid is used extensively in veterinary dermatology to treat many types of the keratolytic these proliferative diseases. So usually the keratolytic agents is prepared as 2 to 10% colloidal and 6 to 3% gel, especially 3 to 10% gel, and combined with sulfur. Salicylic acid is combined with sulfur and recommended for the treatment of seborrheic dermatitis, means the dermatitis which is containing seborrhea. So topical use of the salicylic acid may cause the irritation, especially in the dermatitis, especially in the animals. And ingestion of the salicylic acid overdose can lead to the salicylate intoxication, which often presents the chemically in a state of the metabolic acidosis. So with compulsory respiratory alkalosis, this is very common, whereas the benzoic acid, this benzoic acid, that's phenyl formic acid, that's C6H5COOH, is obtained from the benzoyl or prepared synthetically. So, whereas the benzoic acid is having faint benzoin odor, and like salicylic acid, benzoic acid causes the desquamation of epithelial cells by the dissolving the intracellular cement. So, it is going to remove the unwanted tissues on the skin. In addition, keratolytic action, benzoic acid is antiseptic, antiseborrheic, and the fungicide. So, varieties of the time, these salts are used as a food preservatives. Of course, it is toxic in more quantity. Then sulfur. Sulfur is one of the chemical element with this atomic number 16, one of the basic elements. So, the elemental sulfur is bright yellow crystalline solid with feeble odor. Then sulfur is keratolytic, keratoplastic, antiseborrheic, and the ectoparasiticide agent used in a variety of the topical preparations. So it is also antibacterial and antipruritic and has a mild follicular flushing. Then the keratolytic action of the sulfur is related to the anti-inflammatory process, ultimately causing the inflammatory process and slapping up of the stratum corneum. So initially what we will feel is there is an exaggeration of the disease, then followed by the suppression. Then formation of hydrogen sulfide and pentothelic acid is also responsible for the keratolytic activity of the sulfur sublimate, what we say. And some pharmacological effects are also benefited through the antibacterial and possible antifungal actions. But the sulfur is not one of the degreasing agent. Therefore, especially it is not used as a drying agent like other antiseborrheic agent. So sulfur is slightly irritant to, so dogs and cats may show pruritus sometimes if you use the sulfur preparation. So, and if the animal lick the applied surface, then a sulfur toxicity is also a chance. Then urea, yes, it's an organic compound, a well-known compound. It's available as the hygroscopic, transparent, and the colorless crystals. When used topically, then urea acts as a protein denaturant, then promoting the hydration of the keratin. And once the treated areas of the keratin swell, mild keratolysis issues. So urea containing creams are used as topically dermatological products to promote rehydration and sometimes the skin. So urea in the 40% means 40 grams in 100 ml is indicated for the psoriasis, eczema, then keratosis, then keratoderma, etc. and corns. The use of the urea alone is keratolytic agent and is not common in case of the wet dermatology. So repeated or prolonged contact with urea on the skin may cause the irritation and also sometimes the dermatitis also. So the concentration of the urea should be very, very fixed. Then another thing is the resorcinol. So it is also known as resorcin, or it is a dihydroxybenzene. It acts as a local irritant with mild keratolytic. So the resorcinol is present in many of the wound lotions, especially the dermatitis lotions. The lotions used to treat the dermatitis and modest antifungal and antibacterial activities. So it acts as a protein precipitant and promotes the hydration of the keratin, resulting in the keratolytic action. So the resorcinol is applied topically, especially as lotions, gels, or ointments in concentration. Yes, 1 to 20% resorcinol is present. Then the resorcinol anti-itching cream, most of the anti-itching creams they do contain the resorcinol with the following structure. Usually they are combined with the other keratolytic agents like the sulfur or the salicylic acid. Then large doses, it is a poison and causes salivation, giddiness, and other things. So the animals, when they lick this particular lotion, then they may be caused with toxicity. So please take care of it. Then coal tar is a byproduct obtained from the destructive distillation of the coal, and it occurs as a black viscous liquid with anti-pyretic odor, then insoluble in water and many more, just like the coal tar. So it's also applied as the keratolytic, then keratoplastic, antiseboric, and the counter irritant. So counter irritants are the one which cause the mild irritation or inflammation, so that the area will be cleansed. So the coal tar may be used in some shampoo formulations and contain 20% about the coal tar. So this is having the irritant allergic reactions and yes, applications. Some of the patients may show the adverse effect. So these products should not be used in case of cats. So because it's caused the frequent irritant property, and as the cats lick the body, then they may get the toxicity of the said substances. Then allantoin. So allantoin is a diuride of the glyoxylic acid, and especially it is obtained naturally from the extracts of the comfrey plant and urine from the cows. 1 minute. Yeah. So this is applied topically and increases the water content of extracellular matrix. So varieties of this allantoin are used in different creams, powders, then the ointments. So this increases the smoothness of the skin. Allantoin is obtained in case of shampoos, anti-acne products, etc. So whenever you have the chance of having all these substances, please go through the individual content. Then retinoids. So retinoids already, especially in the vitamin A, we have seen that it is acting as a growth and differential regulators of the skin when administered orally or topically. Especially tretinoin, retinoic acid, it's a product of the vitamin A. So can be used topically to control the idiopathic nasal hyperkeratosis. So this is applied topically, and tretinoin causes the inflammation, thickening up of the epidermis and localized intracellular edema. And because of this thing, the pain will be reduced. So this is containing the retin containing creams are there, ointments are there, and many more cosmetics. So all these are approved by the Drug Controller of India, and also it is FDA approved. Occasionally allergic or irritant reactions, particularly the cats, may be observed, and isotretinoin does 13 cis retinoic acid and the etrekinate is also potentiated veterinary applications and many more used. Side effects of this are the light conjunctivitis sicca, keratoconjunctivitis sicca. I have shown you the photograph, and joint and leg pain will be present. Especially keratoconjunctivitis sicca is dryness of the eyes whenever we use the sulfonamide for prolonged usage, especially in the dogs. Anti-seborics. These modulate the sebum, means secretion of the sebaceous glands, especially produced in skin. And these drugs are effective in seborrheic dermatitis, which affect the areas rich in the sebaceous glands. They also regulate the seborrhea, excessive secretion of the sebum from the sebaceous glands. That leads to the formation of dandruff. So what is a dandruff? So or seborrhea or dandruff are the same, excessive secretion of the sebaceous gland, and they get dried. So that is the secretion leads to dandruff and oily skin. So most anti-seborics also they are the cutaneous irritants and the keratolytics. So they may preclude their use on the diseased skin, especially in case of the animals. So when the animals have been affected with the dermatitis, especially fungal induced dermatitis, a lot of these sebaceous substances or seborrhea or dandruff will be formed. So many of these medicated soaps and shampoos do contain the anti-dandruff soaps. So this is of course useful in the dogs and cats, mainly dogs and sometimes in case of cats. So this is selenium sulfide. Of course, many of you might have used, especially whenever there is a itching in the scalp. That's the Selsum shampoo. I think you might have heard. It's a bright orange powder that is included in many medicated soaps with detergent. So this is one of the substance that causes the selenium toxicity if it is leaked. So when applied externally, it acts as the anti-seboric and also has some anti-dandruff activity. And the selenium sulfide interferes with the hydrogen bond formation in the keratin and thus is a keratolytic agent. So it is having some of the actions, especially the anti-mitotic activity by showing cell proliferation, and the sebum production will be stopped. Then it is often used in the concentration of 1%, like maximum, or sometimes 2.5% for the treatment of the dandruffs, and also the seborrheic dermatitis associated in the scalp with Malassezia genus fungi. So at least 2.5% strength selenium sulfide is also used in the body to treat Tinea versicolor, that's the fungus, especially the Malassezia. In the topical application of selenium sulfide or skin products, negligible side effects or the adverse effects are seen. However, it causes irritation of the mucous membrane. So care should be taken to avoid contact with eyes or other tissues. Then while reasonably safe, it is externally applied, then highly toxic if it is taken or licked internally. So many of the times the dog may die also. So systemic absorption may also occur when it is applied over the damaged skin. But the percutaneous absorption is minimal from intact skin. The persons using selenium sulfide shampoos should carefully wash their hands afterwards. So you may have the many of the shampoos which are containing the selenium sulfide for the anti-dandruff thing. So please wash your hands properly after the scalp is treated with the shampoo. Prolonged use always causes the toxicity like irritating to skin and also the stain hair. That is the color. And benzyl peroxide is a anti-seborrheic and keratolytic agent with strong oxidizing and free radical generating antimicrobial activities. So majority of the topically applied benzyl peroxide is metabolized to this benzoic acid by viable epidermal cells, and which is mainly responsible for the keratolytic and anti-seborrheic actions. So the bactericidal activity associated with benzoyl peroxide comes from its ability to generate free radicals which disrupt bacterial cell membranes. So the mechanism of action, yes, especially it inhibits the epidermal metabolism and the DNA synthesis dermatology. So it is indicated in case of the pyodermas as well as the disease which causes the keratolytis. As a human practice, it is widely used in case of the acne. Then excessive dryness of the skin, erythema, etc. are seen. So it causes the toxicity in higher concentrations. So other antiseptic agents, especially the salicylic acid, benzoic acid, sulfur, resorcinol, and coal tar. So these also process the, apart from this keratolytic agents, antiseboric action also. So the topical corticosteroids, imidazole, antifungals like the varieties of the antifungal agents like ketoconazole and miconazole, etc., are considered effective in relieving the symptoms of the seborrheic dermatitis, including the dandruff, anti-dandruff products. So antiseptics and wound cleansing agents, especially these skins, we already dealt about the antiseptics available in the commercial preparations, and they contain the earlier varieties of the drugs. So we have discussed about all these things in the earlier chapters. And some antiseptics, however, are not applied on the broken skin and wounds due to their irritant or systemic adverse effects. So povidone-iodine, already we have discussed about the iodophoriodine because it is elemental iodide coupled with that of the some of the binding molecules like with the polyvinyl pyrrolidone molecules. So this particle serves as a sustained release product of the iodine and non-staining, non-irritant substance. So the bactericidal action is especially it is due to the free iodine and it is non-irritant in nature. So the povidone-iodine and many more drugs are already, it is very well dealt in the earlier chapters, especially antiseptic and disinfectant. So povidone-iodine, of course, I will not go. It's a very good iodophore ointment, antiseptic, wound cleansing agent. Yes, it also acts in the presence of the pus and abscesses, injuries. So many applications are there, and it acts for 4 to 6 hours. So the povidone-iodine may be absorbed systemically when it is careful about these things. So the chlorhexidine is one of the very good agent that prevents the COVID-19, and also it is containing the mouthwashing or the mouth fresheners. So this is containing the chlorhexidine, then diclofenac, antiseptic mouthwash. So especially the mouth ulcers, etc., will heal very fast whenever we use chlorhexidine. One of the very good agent, especially chlorhexidine, non-toxic, non-staining, then very less residual activity, so it binds to the proteins of the stratum corneum. Then hydrogen peroxide, we have dealt it, but it's a sporicidal agent, but sometimes it is also toxic, as we have already discussed. So the effect lasts only long as long as the hydrogen peroxide is there, and it produces the nascent oxygen, or the hydrogen peroxide will destroy the spores of certain bacteria and used as 3% solution. Sodium chloride, all common salt position, even the fresh wounds are always, they can be washed with the sodium chloride, that's 0.9%. Especially the contaminated wounds, because it is non-irritant, and infected wounds should be treated. So because in the hospitals you may get the 0.9% sodium chloride, and hypertonic sodium chloride may also be used for the particular purpose. So, or the magnesium sulfate 10% solution. That's the isotonic sodium chloride solution is 0.9%, means 900 milligram in the 100 ml, 0.9%, and safe and effective wound cleansing solution. Then alcohols, though ethyl alcohol or isopropyl alcohol are very famous nowadays, especially in the sanitizing ointments, sanitizing solutions. Then these agents, especially they are having the slightly volatile properties, then used for the sterilization. But one should be very careful while using them in presence of the fire, etc., because of the highly inflammable nature of the alcohol prevents them, especially the sterilization, etc., need to be very carefully. So they are always used for the preparation of the skin before the surgery. And glucocorticoids, yes, many of the ointments nowadays do contain glucocorticoids, especially they are used in topical skin preparations, either alone or in combination with some of the antibiotics like neomycin and the antifungal agent like the ketoconazole and miconazole, etc. Then topical glucocorticoid preparations are used mainly to treat limited areas of the diseased skin. So they benefit mainly by the virtue of their anti-inflammatory and then immunosuppressive, the vasoconstrictor, then anti-proliferative for scaling lesions. So, but need to be used carefully because it is directed at the dermis, and epidermis is not intended to produce the systemic anti-inflammatory effect. So the glucocorticoids, as you know, adrenal cortex, it stimulates the varieties of the mineralocorticoids and glucocorticoids, then secretes the glucocorticoids and also the adrenocorticotropic hormone. Then the systemic absorption may also cause by the leaking of the treatment ointment and may cause varieties of the side effects like the polyuria, polydipsia, etc. Then these are used carefully for a very short period because it is one of the strong immunosuppressing agent and may suppress the inflammation. But later, once it is taken out, then the condition may get worsened. So the agents used, especially topical agents, are the hydrocortisone, prednisolone, betamethasone, dexamethasone, fluocinolone. So that's about the anti-mucolytic agents. So we'll switch on to the another important chapter, especially the drugs, fluid and electrolyte therapy. Just wait for 2 minutes, I will change it.